right, the first question is on health care. As we all know, Medicaid expansion passed at the ballot box in November of 2017. It's caught up in the Maine legal system right now. When implemented, this will provide health care access to an additional 70,000 low-income Mainers. Medicaid expansion will open up health care access to adults who earn less than 138% of the federal poverty level, which is about $16,000 for one person and roughly $22,000 for a family of two. So, according to recent news articles in the Pullman Press Herald, the LePage administration is rejecting applications for Medicaid from people who became newly eligible for the program as of July 2nd. We have concerns about this. So the first question, and I will go from right to left for this question, is do you believe health care is a moral imperative and a human right? And I can either ask you that or to follow up to it now and have you answer both at this time. I think that would be better. Okay, so do you believe health care is a moral imperative and human right? I'll start with that, with Ms. Bellows.
So you could all work together?
I support universal single-payer health care. I think it's a federal issue that we need to solve nationally, and I do support Medicaid expansion. And I want to share with you, this morning I was on the phone with a gentleman who has health insurance. His wife was diagnosed with cancer last winter, and she was rushed from the hospital in Augusta to Portland. Several months later, as they were struggling with this diagnosis, they received a bill for the ambulance ride. And so we were trying to navigate with insurance companies and with the insurance company, with health care advocates, what he could do. And it turned out that, unfortunately, the ambulance company should have filed a claim with his insurance company, but they didn't. So now he's probably on the hook. This is just one example of how our healthcare system is utterly and completely broken. People with health insurance have huge deductibles, skyrocketing premiums, and it's just not working. Thank you.
Kusiak. I also would definitely support Medicaid expansion. In fact, I did. I voted for it when I was representing Fairfield several years ago. I would like to see a single-payer system from the federal level that would cover all Americans. In the meantime, I've been moved by the work of, I think it's Maine All Care, and I was talking with some folks in that organization this weekend about their attempts to educate Mainers about the benefits of a single-payer plan here operating at the state level. And, there are just many benefits to it. As far as a story about a constituent, at Doore, so much I haven't heard about Medicaid expansion. Some people who know or are in the medical field will say, yes, we need to definitely expand that. I'm glad you stand for that. It will assist with positions and jobs. But I also hear about the high cost of programs for people who are covered and the high cost of their medications and problems with them.
Jan Collins. I do support Medicaid expansion, and I also support universal single-payer health care. I believe that health care is a moral and human right, that health care should not be dependent on how much money you make, that we all deserve health care. 50% of all bankruptcies occur as a result of a medical issue. People should not have to lose their homes in order to get good health care. I have many, many stories I could tell about health care needs, especially for those who are elderly or on fixed incomes. It might take me too long to do that. So I'll leave it at that. Thank you.
I'm Lindsey, Harwath. Yes, I believe that we should expand Medicaid. Not only is that my personal belief, but we've already voted on it. So I feel like it's our duty to do what the people have already said that they want to do, and that's what we're here for. So even if I didn't agree with that, it's still something that should be done because that's what the people have voted on. I do believe that healthcare is a moral imperative and a human right. My husband does lots of humanitarian work. We have experience traveling after natural disasters all over the world, and we've lived in Japan. And I think there's a lot that we can learn from other cultures who also have an aging population and how they treat their citizens.
Thanks, Lindsey. Ken Ackley from Monmouth. And I do support Medicaid expansion and also recognize that access to health care is a human right. And I think I look at our current system and the inefficiencies that are part of our current system. The law already says that when someone shows up to the emergency room, they get care. They get a standard of care that is the minimum and acceptable from the American Medical Association. It doesn't matter. So this is really a settled issue. It's already recognized as a right, and really what we need to be focusing on is what is the most efficient way of delivering that. Because 70,000 Mainers using the emergency room as a primary care source is not an affordable health care.
Thank you. I also agree that health insurance should be a right, not a privilege for just the wealthy. I voted for Medicaid expansion at least 5, I think it was 5 times, maybe 6, but I think it was 5. And quickly, in case any of you didn't see my column in the Kennebec Journal or the Portland Press Herald, I live every day. I have a son who's almost 40 who is very, very sick with Crohn's disease. He has no insurance. He is fighting right now to keep his SSI that was taken away 2 months after our new president came into term. So we fought that, and he is coming for insurance. But every 6 weeks he goes for an infusion that's $1,800. His Social Security benefits at $1,200. And I can tell you, personal experience, that you get treated totally different if you're not insured, if you have health insurance. And as a 2-time cancer survivor, it's very expensive. So I am in favor of Medicaid expansion, and insurance should be a right for everyone in this country, not a privilege like it is in every other industrial country. Thank you.
Short answer is yes and yes. One of the points that I make to people when I'm out in the field is that what we have now is not health insurance, it's a reverse lottery ticket you hope you don't have to cash. And personally, if I had a boss who gave me a directive at work and I didn't follow that directive, I ought to be fired. Message to the legislature and the government.
I think that healthcare is absolutely a moral imperative and a human right, and our current approach of healthcare for the lucky is at best amoral, bordering on totally immoral. Furthermore, it is an economic imperative. Keeping people sick or saddling them with crushing medical debts is bad for our economy, and that it doesn't matter what your ideology with respect to healthcare as a human right is, we can all agree that we shouldn't be crushing our economy with medical debts. I have a constituent who got cancer just out of high school, and even though he's now completely employed, he will likely never be able to own a home because of his medical debts. I think that is indicative of what's happening in our society.
Thank you. Colleen, Madigan. Yes, I absolutely support Medicaid expansion. I've voted for it a number of times. And yes, I believe healthcare is a moral and human right. There's no excuse for this country for people to not have access to healthcare. I explain all the time that Medicaid expansion primarily helps working people because it helps people who are up to 138% of the poverty level, which primarily is people working, not getting enough hours or working for a minimum wage. And I just want to mention a couple things. One is I have a friend who, rationing insulin. I had a man who made pizza, a local pizza place, who had very brittle type 1 diabetes, a son of a friend of mine who I did with. And he died a year and a half ago because he was trying to ration his insulin, which is just ridiculous for a man who probably made your pizza, and he's no longer with us. I also spoke to a man over the weekend. His wife has a chronic health condition. She's 61 years old. She doesn't qualify for Medicare. They're paying $900 a month because she can't go without oxygen. So they're going without other things. And this is someone, a family in Waterville. And there's no excuse for that in America.
Yes, I'm in favor of Medicaid expansion, not only for the bill that was passed and that the public has approved, but there's also aspects of transportation that could be covered under Medicaid that aren't in the state of Maine. And when you're talking about a state of Maine that doesn't have a huge tax base, the population is much more elderly than most other states in the country. I think that you've really got to maximize the dollar by making Medicaid expansion, by approving it as much as you can. And I believe that coverage for healthcare is a human right. And I believe it's one of those functions that government should undertake. And I also believe in a single payer system. I'm 69 years old. I have Medicare. That works fine. And the administrators of the program don't make $7 and $8 million a year. And I think, that's the route we should take.